It's a feeling as quiet as dust settling in an empty room, isn't it? The word that used to be right there, a familiar tool in your hand, suddenly vanishes. The name of a neighbor you've known for 20 years evaporates just as you go to greet them. You stand in the doorway of your kitchen, the hum of the refrigerator the only sound, and a cold, quiet panic sets in. Why did I come in here? We call them senior moments. We laugh them off, pat each other on the back, and say, it just comes with the territory. We blame aging, as if aging itself is a disease, a fief that creeps in and selectively steals the most precious parts of us, our memories, our very narrative. We accept the fog as inevitable. But what if it's not? What if that fog, that creeping, insidious grayness that dulls the sharp edges of your world, isn't a symptom of time passing, but a symptom of something else entirely? What if it's not inevitable, but induced? What if the thief isn't time, but something we willingly invited into our homes, something sitting right now in the one place we trust the most, our medicine cabinet? Today, we are not talking about the complex, terrifying diagnoses of Alzheimer's or vascular dementia. We are talking about a shadow, a mimic, a precursor that we are doing to ourselves, often with the best of intentions, simply trying to get a good night's sleep, or stop a running nose, or calm an anxious bladder. We are talking about an everyday, over-the-counter, seemingly harmless class of medications that for seniors is quietly and profoundly triggering severe memory loss. And the most shocking part? We've known about it for decades. This is a warning, yes, but it is also a message of profound hope. Because unlike the relentless march of time, this we can change. We are going to pull back the curtain on the medications known as anticholinergics. It's a complex-sounding word, but its function is alarmingly simple. It blocks a vital messenger in your brain. And in the process of blocking that messenger to solve one problem, it starves your brain of the very chemical it needs to form and retrieve memories. This isn't a rare exotic drug. This is diphenhydramine, the main ingredient in Benadryl, in Tylenol PM, in Advil PM. It's in medications for overactive bladder like oxybutynin. It's in older antidepressants. It's in pills for motion sickness and vertigo. It's the PM in your nighttime pain reliever, the sleep in your sleep aid, the calm in your allergy pill. And for millions of people over 60, it's a daily habit. This is the conversation your doctor may not have had time to have with you. This is the information you need to reclaim the clarity you thought was gone for good. Let's step out of the fog, together. The first thing to understand is that your body is a deeply interconnected system. You cannot push on one part of the web without making the entire thing tremble. We've been taught to see our bodies as a collection of separate parts: the brain, the bladder, the nose, the joints. We take one pill for our head, one for our stomach, and another for our aching knees. But the body doesn't work that way. It's a symphony, and if you silence the violin, the entire melody changes. This principle of systemic connection is the most overlooked and most powerful force in our health. We focus on the symptom, the foggy brain, the creaking hinge, while ignoring the systemic imbalance that's causing the problem. We've been trying to fix the creak in our joints with solutions that only paper over the problem, when the real breakthrough is understanding the foundation of the system itself. It's this foundational science that's so exciting, not just new drugs, but new understanding of how our bodies actually work, especially in supporting the fundamental scaffolding of our lives, the cartilage and fluid that allows us to move. It's a fascinating, revolutionary new way of looking at health. I've put a link to a breakthrough study in the pinned comment below. It's a quick read, but it completely reframes how we should be thinking about our joints and our body's interconnectedness. It's worth your time. Now, let's talk about the brain. To understand the enemy, we must first understand the friend, a molecule named acetylcholine. Think of your brain as a vast, magnificent library, holding every memory, every experience, every piece of knowledge you've ever acquired. But a library is useless without its librarians. Acetylcholine is your head librarian. It's the neurotransmitter, the chemical messenger that is in charge of learning, memory, and attention. When you learn a new fact, it's acetylcholine that runs to the shelf, finds the right spot, and carefully places that new book of information. When you need to remember a name, it's acetylcholine that zips through the stacks, retrieves that specific book, and brings it to the front desk of your consciousness. Without this librarian, the new books never get shelved. They're left in a pile by the door, and by morning, the janitor, your brain's natural cleanup crew, has thrown them out. This is why you can have a conversation and an hour later have no memory of it. The book was never shelved. Now, what does an anticholinergic medication do? The name says it all: anticholine. It is designed to block acetylcholine. It goes into your brain and essentially fires the librarian. It puts closed signs on all the docking ports, the receptors, where acetylcholine is supposed to deliver its messages. Why on earth would we invent a drug that does this? Well, in other parts of the body, acetylcholine does other things. It tells your sinuses to produce mucus. It tells your bladder to contract. It tells your stomach to churn. So, if you have a running nose, an anticholinergic, like Benadryl, is very effective. It blocks acetylcholine, the nose stops running, the eyes stop watering. If you have an overactive bladder, an anticholinergic like oxybutynin blocks acetylcholine, the bladder calms down, and the urgent need to go subsides. The problem is these drugs are like a clumsy giant. They can't just block acetylcholine in your nose or your bladder. They are dirty drugs. They cross the blood-brain barrier, the protective wall around your brain, and they go stomping through your mental library, putting up closed signs everywhere. The librarian is shut out, and the memory center of your brain, the hippocampus, grinds to a halt. You didn't just stop your running nose. You stopped your ability to form new memories. This isn't theory. This is documented, large-scale science.
The study that should have been a global headline was published in JAMA Internal Medicine. Researchers at the University of Washington followed nearly 3,500 seniors for an average of 7 years. They meticulously tracked every medication these participants took using their pharmacy records. They weren't asking people to remember what they took. They had the data. What they found was a clear, terrifying, and dose-dependent link. The more anticholinergic medication a person took, and the longer they took it, the higher their risk of developing dementia. Dose-dependent is the key phrase. Taking one Benadryl for a bad allergic reaction one time is not going to cause dementia. The danger is the cumulative burden. The researchers calculated it. They found that taking a high dose, which could be as little as 1 Tylenol PM or Benadryl every single night for 3 years, or a moderate dose for 6 years, was associated with a staggering 54% higher risk of developing dementia compared to those who took none. And the risk of Alzheimer's specifically was 63% higher. Think about that. 3 years of using a harmless sleep aid. How many people do you know who have been doing just that? Year after year, desperate for sleep, not realizing the price they were paying. The fog you feel isn't just in your head. It's a real physiological blockade. It's the lights in the library being turned off one by one. And if this information is resonating with you, if you or someone you love has been walking in this fog, please take a moment to press that like button. It's a simple click, but it tells the algorithm that this conversation is important, that this warning needs to be heard by others who are still in the dark. The scientists behind these studies were clear. This is not a risk of dementia, it's a direct cause. The anticholinergic burden was physically shrinking the brains of the participants. They had lower brain volume, especially in the hippocampus, the memory library itself. They had less glucose metabolism in that area, meaning the library wasn't just closed, it was losing its power, its lights dimming. This is the insidious nature of the problem. It doesn't happen overnight. It's not a stroke. It's a slow-motion dimming. You take a pill to sleep, you wake up, maybe a little groggy, but you got your 8 hours. You blame the grogginess on a sleep hangover. A few months later, you find yourself struggling for words more often. You blame age. You have trouble following the plot of a complex movie. You blame stress. You forget an appointment. You blame your busy schedule. You are, in effect, accommodating the fog. You are shrinking your life to fit the new diminished capacity of your brain, all while the culprit sits in your nightstand drawer, disguised as a friend. This is a tragedy in slow motion, and it's a tragedy that so many are completely unaware of. What's the one small subtle change you've noticed in yourself that you've dismissed as just getting older? Share it in the comments below. When you read the other stories, you will realize you are not alone in this, and that these are not individual failings, but a shared and solvable problem. The most devastating part of this is that the senior brain is uniquely vulnerable. As we age, our blood-brain barrier becomes a little less robust, a little more leaky. It's easier for these drugs to get in. At the same time, our bodies get worse at clearing these drugs out. Our liver and kidney function slows down. So a dose of Benadryl that a 30-year-old could clear out in a few hours might linger in a 70-year-old system for a day or more, building up a cumulative poison night after night. You are, quite literally, operating with a handicapped brain. You are trying to live your life with a permanent chemical off switch flicked in your head. Now, a critical life-saving warning. Do not stop taking any prescribed medication without talking to your doctor. This is not a video about medical rebellion. This is a video about medical empowerment. If you are on an older antidepressant like amitriptyline or a bladder medication like oxybutynin, these were prescribed for a reason. Stopping them cold turkey can be dangerous. The goal here is to arm you with information so you can have an intelligent conversation with your healthcare provider. The goal is to walk into that office and say, "Doctor, I'm concerned about my cumulative anticholinergic burden. Can we review my medication list and see if there are safer non-anticholinergic alternatives for my condition?" This is the moment of discovery. This is where the hope comes in. Because for so many of the conditions these drugs treat, there are better, safer, and more effective alternatives. This is the breakthrough. The fog can lift. Let's take the biggest culprit, sleep.
Millions of seniors take PM pills because they can't sleep. But insomnia is not a diphenhydramine deficiency. Insomnia is a complex issue, often a behavioral one. The gold standard, the #1 recommended treatment for chronic insomnia, is not a pill. It's called CBT-I, or cognitive behavioral therapy for insomnia. This is a set of tools that retrains your brain to sleep naturally. It involves things like stimulus control, getting out of bed if you're not asleep after 20 minutes, so your brain stops associating your bed with frustrated awakeness and relearns that bed equals sleep. It involves sleep restriction, where you actually reduce your time in bed to consolidate your sleep, making it deeper and more efficient before gradually expanding it. It's about light hygiene, managing anxiety, and creating rituals. It's work, yes. It's not as easy as popping a pill, but it works, and it has 0 side effects. It doesn't just mask the symptom, it solves the problem, and it doesn't steal your memories while it does it. What about allergies? That's an easy one. The first-generation antihistamines, like Benadryl, diphenhydramine, are the dirty ones that swarm the brain. The second-generation antihistamines, think Claritin, loratadine, Zyrtec, cetirizine, Allegra, fexofenadine, were specifically designed to not cross the blood-brain barrier. They are much, much safer. They do their job in your sinuses without firing the librarian in your brain. This is a simple, easy switch that your doctor or pharmacist can guide you on. What about an overactive bladder? This is a more complex medical issue, but even here, the first line of treatment shouldn't be a powerful anticholinergic drug. The first line is behavioral changes like timed voiding, dietary changes, reducing caffeine and alcohol, and most importantly, pelvic floor physical therapy. A trained physical therapist can teach you exercises to strengthen the exact muscles that control your bladder. It's empowering, it's effective, and it has no cognitive side effects. The discovery here, the revolutionary idea, is that you are not a passive victim of your body's aging. You are the manager of it. You have agency. You have the power to question the pill. You have the power to ask for alternatives. You have the power to choose a path that doesn't force you to trade your memory for a quiet bladder or a night's sleep. And if you're finding this information valuable, if it feels like a light has been turned on, please consider subscribing to the channel. We are dedicated to digging deep into the science of aging well, of challenging the old narratives, and giving you the tools you need to live a vibrant, clear-headed life. We are on this journey together. But what if you've been taking these pills for years? Is the damage permanent? Is the fog here to stay? Here is the most beautiful, hopeful, and scientifically thrilling part of the entire story. No, the brain is not a static, fixed object. It is a living, dynamic, and profoundly resilient ecosystem. It has a property called neuroplasticity. This means it can change. It can rewire itself. It can build new pathways. It can heal. When you stop the anticholinergic assault, when you stop firing the librarian every single night, the library can reopen. The librarian comes back to work. The closed signs come down. The acetylcholine can flow freely once more, and the books can be shelved. Studies have shown that when people stop taking these drugs, their cognitive scores, their memory tests improve, sometimes dramatically, and sometimes within weeks. The fog lifts. The light comes back on. It's like the world turning from black and white back to color. You are not losing your mind. You were, perhaps, just blocking it. And you can unblock it. But stopping the poison is only step one.
Step 2 is actively rebuilding the library. It's not just about stopping the damage, it's about repairing it. This is where the power truly returns to your hands. How do you rebuild a brain? How do you foster neuroplasticity? You do it by giving the brain what it was designed for. First, you feed it. The brain is 60% fat. It needs high-quality fats to rebuild its cells. We're talking about the omega-3s in fatty fish like salmon, in walnuts, in flax seeds. We're talking about the antioxidants in blueberries. They call them brain berries for a reason. In dark leafy greens, in colorful vegetables. The Mediterranean diet has been shown time and time again to be the ultimate brain protective diet. You are, quite literally, eating the building blocks for new thoughts. Second, you challenge it. A brain that is not challenged is a brain that is pruning itself. The use it or lose it principle is the absolute law of neuroplasticity. But this doesn't mean doing the same crossword puzzle every day. That's just treading water. It means learning. Something new. Something difficult. Learn a musical instrument. The coordination of hands, eyes, and ears is a symphony of new neural pathways. Learn a new language. It builds entirely new cognitive structures. Learn to paint, to code, to garden. The act of struggling and improving at a new skill is the physical act of building a bigger, better brain. It's the rain that follows the drought. And third, you move. This is the miracle. We used to think of muscle and mind as separate, the jock and the nerd. This is perhaps the single biggest misconception of modern medicine. Your muscles are a chemical factory for your brain. When you do moderate exercise, even just a brisk walk, something that gets your heart rate up, your muscles release a flood of chemicals. One of them is called brain-derived neurotrophic factor, or BDNF. Scientists call this Miracle-Gro for the brain. It is a protein that acts as a fertilizer for your neurons. It helps them grow. It helps them connect. It protects them from damage. It is the single most powerful tool you have for encouraging neuroplasticity and fighting cognitive decline. Every time you walk, every time you lift a weight, every time you get up and move, you are not just strengthening your body, you are releasing a healing, restorative, memory-building cocktail directly into your brain. This is the profound connection we've been ignoring. The health of your muscles is inextricably linked to the health of your mind. We've been so focused on the pill, the drug, the quick fix, that we've ignored the power plant we all carry around with us every single day, our own bodies. The fog of anticholinergic medication is real. It is dangerous and it is pervasive. But it is not a life sentence. It is a choice. It is a solvable problem. The path to clarity is not about finding a new miracle drug. It's about awareness, reviewing your medications with your doctor. It's about alternatives, choosing CBT-I over a pill. And it's about rebuilding, feeding, challenging, and moving your brain. You are not just getting old. You are a complex, resilient, and magnificent system. You have agency. The fog can lift, and when it does, you might just find that the sharp, clear, vibrant mind you thought you had lost was simply waiting for you to come and find it. We've spent this time talking about the off switch, the chemical blockade from these medications. But the real, lasting key to a clear mind, as we've just discovered, is the on switch. It's the Miracle-Gro you create yourself. This link between our physical strength and our mental clarity is the most powerful and hopeful discovery in modern aging science. It's the key to not just a longer life, but a better one. And that is why the very next video you should watch, the video I've queued up on the screen for you right now, is Best Anti-Aging Foods. It is the perfect next step on this journey. Click it now. Let's continue this path to reclaiming not just your mind, but your entire life.